me begin again. Let me try here. Patrick, we thank you for hosting this forum. Let me thank all of you who come out today, and let me also thank the personnel at Griffin+Hospital for hosting us. It's not off the table, my friend.
Let's have some questions.
We're going to.
Let's have some questions about it. Can you tell us about it right now? What is your stand on single-payer healthcare environment?
We'll get to it.
All right.
Jeffersonian democracy at work here. Well, I was going to invite the Attorney General up to speak a little later. Maybe I'll have him up a little earlier on the program. Well, look, again, let me thank everyone for coming out. And we have a wonderful guest with us, Nancy Endepal, who is, I asked her to come to the state. I thought it would be worthwhile for us to hear from the person who is the point person in the White House, who'll be giving us a lot of direction from the Obama administration as to what they'd like to see as part of the health care debate. So, Nancy, and we thank you immensely for being here. And thank you. Put a round of applause for This is the fourth of these forums we had. We had one in Danbury, one in Hartford, one in Groton, and of course one here in Derby, Griffin+Hospital, to listen to people. And there's not a point of giving speeches here, obviously, just to welcome people to the forum, and then ask our audience and others to let us know their questions here, our ideas and thoughts as well, on how we progress. I'm more optimistic about this than ever before. And obviously it's not going to be easy. It would be a mistake to say it's a fait accompli. But the world has changed dramatically. Since 15 years ago, the last time an effort was made on national health care, there were huge, huge divides in the country. And something Rosa just said, I think, makes it even more poignant. Because we're losing 20,000 jobs a day in the country, 10,000 people every day in this country are losing their homes. The worst economic crisis in the lifetime of most of us alive today in this nation. And so for those reasons, healthcare is a critical component. It's not a separate issue. 17% of the gross domestic product of the country is consumed by healthcare costs. Some anticipate that may go to 36% in very short order. And so whatever other reason may feel at the table, the morality, the ethics of it, the need to make sure that more Americans are going to get coverage, the idea that people want to keep what they have the choices they'd like in healthcare, are all compelling. But we must deal with this. There's no other choice. There is a mandate out there to deal with this issue, and I'm optimistic for that reason that we will. We've got a president who cares about it very deeply. We're working together on both sides of that political divide in the country to come to that conclusion of what needs to go forward as part of that plan. The world will not change overnight if we even adopted a plan tomorrow. It'll take time to put this in place. But there is a census of principles I think all embrace. The idea of dealing with cost, obviously, is paramount. We've had a 42% increase in Connecticut in healthcare premium costs just over the last 8 years. That's got to be dealt with. We'd like to see a plan that covered far more Americans, universal in many cases, where you today have 45 million who are being excluded. We want quality and we want prevention, if we can, to change the dynamic. This hospital reflects in many ways, I think, what people would like to see in the country. This patient-friendly, patient-hospitable environment that Griffin+Hospital has created, where we try to get people out of this institution, not invite them to come back in, where prevention of avoiding the kind of chronic illnesses that affect so many in our country. That's the effort. It's going to take time to achieve all of those goals, but we must begin so. I think it's shameful in our country that we rank among the tops among industrialized nations in infant mortality. The United States of America ought not to be in a situation where we rank as high as we do in the number of children in our nation who are suffering terribly because of the lack of adequacy or access to health care in our nation. So there's some many, many significant challenges we face in the coming weeks and months to get this right. But we have no other choice on behalf of the people of this nation but develop a plan that will allow us to deal with those issues. Affordability, universality, prevention, and quality are all critical elements to come together. And so I thank all of you for coming out who care about this deeply, who want to see the kind of change we've been calling for. We have an opportunity to do that now in the coming weeks. This will be the last of the forums here in Connecticut, but it doesn't close the door on people expressing their ideas and views. To work closely with people like Chris Donovan in the state legislature to make sure what we do nationally is going to conform what's being done here at the state level. An Attorney General who cares deeply about this issue. It has been in the forefront of helping us frame these plans as we go forward. People like Juan Figueroa in Sustanet, an idea that I think has wonderful, attractive elements that we ought to be considering on a national level as part of that plan. To be able to have Judy Stein, who is such an advocate for elderly and Medicare, makes such a difference in people's lives. Ron Williams is here. Ron is the CEO of Aetna. To have a CEO of an insurance company show up at a public forum You may agree or disagree. I like the fact he's here and willing to stand up and tell us what he thinks is going to happen from the insurance side of the equation. I thank you, Ron, for coming. So we've got some wonderful people we want to hear from. Tom Swan from the Connecticut Citizens Action Group is here. Members of the state legislature. And so this is an opportunity over the next hour and a half to have that good discussion. Let us know your views and ideas and thoughts. And with that, let me introduce Nancy Endepar. Nancy End, as many of you know already, is the point person, as Rosa said, at the White House on healthcare issues. She'll be working with all of us who are involved in this in a very direct way. She ran the health department, the youngest person to do so in Tennessee. She worked in the Clinton administration on Medicare and Medicaid. She is a graduate of Harvard Law School, a Rhodes Scholar, where she went to Oxford, a talented, bright individual who frankly stepped up when she could have decided to stay out in the private world and not step back into this fray and debate. I asked her to come here today, to come to our state, to listen to my constituents, to hear your ideas, your thoughts on how we might move forward. That's the kind of involvement we need more of. Would you give a warm welcome to Nancy Endepar?